Okay, so good morning, everyone. My name is Reggie Brookins. I'm a senior ambassador at King Jude Magna High School of Medicine and Science, and I welcome you all to Careers Talk. Today we'll be having Miss Nicole of Charleston University and her amazing team of, is it physician assistant students? Okay, so yeah, her and her team will be leading us in our presentation as well as a student panel. So without further ado, I pass it to Miss Nicole.
Wonderful. Thank you so much, Reggie. I'm so excited to be here to talk with all of you, to introduce our program and ourselves, and hopefully this can be a longer term relationship amongst the institutions. So this can be very informal. You know, I don't know how you guys usually do it. If you want to raise your hands to ask questions, or if we should just hold off till the end for questions, that's fine too. I'm going to go ahead and share my screen and start the presentation, and Beverly is going to start it for us.
All right. Good morning, everyone. My name is Beverly Uzoma. I'm a second-year PA student at Charleston University. So for today's presentation, we're going to be talking about what is a PA. PA is short for physician assistant. And we're also going to give information on whether you should consider becoming one and what the process is for that. So next slide for me, please. Next slide. Sorry, I don't know. You can hear me. Okay, so the agenda for today is you're listening to me, I'm giving the introduction, then David is going to describe what a PA is, and he's going to go through the history of the profession as well. And then Daphne is going to explain to you, how do you become a PA? Like if you want to start this journey, what should you be doing now that you're in high school and then college and thereforth? Then Nicole will end it off with giving some statistics about the profession in regards to money, salary, job satisfaction, all the things that, you know, we have to consider when we decide what we want to do after school and for our careers. And then she'll wrap it up. We'll start the breakout rooms, and the King students can ask any questions for the current PA students and vice versa. Next. So you are listening to the PA students at Charleston University. So right now we have the class of 2021, which is the class that I'm in. We're going to be graduating in December. So for the presentation in the breakout rooms, you'll be listening to Nicole, me, Val, Shelby, Jandy, and Katarina. And we also have the class of 2022 students who are graduating next year in December. This is their first year, so they kind of have more recent insight on the process in regards to applying for PA school. If anything has changed, they'll be the ones to be able to explain that to you. And some of those classmates are Daphne, David, and Sophia. So what I'm going to do is just explain the vision and mission at Charleston University. It may be similar to the mission at your current school, since they're right next to each other. But basically our vision is to provide excellent health and wellness for everyone in a world without health disparities. And as you can tell in recent news and everything there's going on, there are significant health disparities in our world. And the only way that we can kind of combat them is if we have competent healthcare providers that have the education and resources and empathy to provide adequate healthcare to underserved communities. So that is part of CDU's mission as well. And the way that they do that is that they give us great information on research, and they really push us to participate in clinical service and in engaging with the community. So every semester we have to go out into the community, specifically SPA 6, to kind of see what's going on in the community, how we can help, and just reaching out in any way that we can and advocating for the community as well. So you're going to be listening to students who have that mission in mind. And so we want you to keep that in mind as well as you consider the PA profession. So now I'm going to just hand it off to David, who will describe what a PA is.
Well, I'm David. I'm very excited to be here. Thank you for having us. I'm a first year. As Beverly was telling you guys earlier. So we just started earlier or at the end of last year. So we haven't been with the program as long as the second years, but hopefully we have some good information for you today. So first, talking a little bit about what a PA is. We are licensed healthcare providers who practice medicine with a physician. So that's kind of where the physician assistant comes in. And PAs, so there's kind of a little bit of a question of, what can a PA do versus a physician, and what are the limitations with that? So PAs can treat, diagnose, prescribe medications, assist in surgeries, perform procedures, and manage patient care. So just to clarify a few of these, the assistant surgeries, the PAs will generally do a lot of pre-op and post-op care, and do some of the minor different surgeries, and kind of like some of the more procedural things like opening and closing and stuff like that. So they can do surgeries in that capacity, which is pretty cool. How does a PA differ from an MD and a nurse? So generally the PA's scope of practice is determined at the practice site, and it's adaptable. The supervision level is adaptable, and the collaboration requirements vary a little bit from state to state. But generally, you do have to have that, that relationship with the physician who's kind of, overseeing things a little bit. But there are some other differences as well. The path to degree and the length of education. So here's a big difference between if you want to become a physician versus a physician assistant, is the length of education. So just to talk about that a little bit, our program is 27 months, and most programs are about 24 to 27 months. So you're looking at about 2 years, a little bit more, maybe 2.5 years, depending on the program. That's opposed to an MD, which is a 4-year program. You have a year of internship, and you have, depending on what you specialize in, another 2 to 7 years of residency. So that's a lot bigger of a time period before you can really get into the profession in your full scope of practice. The other one that I wanted to talk about was a nurse, the kind of like the nursing path. So the nurses have a 2-year, so you have 2 years of general education in college, and then you can get your Bachelor's of Science in Nursing, which is another 2 years of college courses to get your initial bachelor's degree. In addition to that, to get a doctorate of nurse practitioner, it's an additional 3 to 4 years, or a master's in nursing is an additional 2 to 3 years. So there's after you get your Bachelor's of Science in Nursing, there's further opportunities to increase your education level at the nursing level as well. So I just wanted to talk a little bit about those different lengths of the degrees, and kind of how long it takes for a PA versus an MD versus a nurse. So PA, 27 months, about 2 years, 2.5 years, a little bit of a shorter path to get into the workplace. Areas of practice and lateral mobility. So this is one of the things that is a big, a big thing that the PA profession has that a lot of the other professions don't have. So as far as lateral mobility, just to talk about that, when you go down the physician path, you have to, pick what you want to do, and that those years of residency and everything, those are all for one specific thing. So if you want to be, an emergency medicine physician, and you take all those classes, then you're that unless you decide to change and then do another, 6 years of residency. So you're pretty much locked in. You can change if you really wanted to, but that's, it's going to take a long time to do that. Physician assistants are trained to be more general providers. So we have a lot of lateral mobility. You can do one thing, and then you can, switch over to something else, and you'll still be qualified to do that. So that's kind of a big plus for the PA profession. You're not as locked into any one thing, which is, I think a good thing for us. As far as the areas of practice, so I wrote down a few of the more common areas of practice. Historically speaking, PAs have kind of been filling the role of general practitioners, and that's true to this day. As of 2017, about 19.2%, so almost 20% practice family medicine or general practice. 18.5% are surgical specialties, so that's like another 20% are surgical specialties, so that's 40% right there. 13% emergency medicine, 15% internal medicine, 4% dermatology, and then it kind of goes down from there, about 2% pediatrics, and 1.5% OBGYN. So you can see it's a big scope of different things you can do. Certainly you don't have to, practice family medicine or general medicine, but those are historically kind of been the niche of the PA. All right, Nicole, next slide. Thank you. So just to talk a little bit about that history, here we have Dr. Eugene Stead on the left, and he's kind of credited with being the founder of the PA profession. So Dr. Eugene Stead modeled the PA profession off of this gentleman here on the right, who is Mr. Treadwell, who he was part of the, they were working out in rural North Carolina, and they noticed that because of the increase in demand for having more patients to treat than you have your hands available to treat them, they kind of did this. They trained somebody to be an assistant almost, and then it kind of took off from there. And they modeled the MedX program, which is the first iteration of the PA profession. And now recently, it's turned into a master's degree. So we can talk a little bit about that. The first program was in '65 through Duke, and it was the returning military corpsmen who had a lot of experience, and they kind of wanted to have a way for them to have a little bit more responsibility and ability to practice. So that first class graduated in '67, and very shortly in the grand scheme of things, CDU started our school in the PA program in '71, which is one of the first PA programs in the nation and in California. It was a very early starting school as far as the PA progression goes. And we had it since '71 as the MedX program. And then in 2011, we took a little bit of a hiatus to revamp the program and then come out with the current program, which is the master's degree program. So that opened up in 2016. So that's where we're at now. Next slide. And I believe this is where I'm going to hand it off to Daphne, who's going to talk a little bit about how to become a PA.
Thank you, David. Good morning, everyone. My name is Daphne Joseph. I am a PA student in the first year. Thank you guys for having us here with you this morning. So I have the opportunity to answer the golden question: how do you become a PA? So number one is you need a 4-year undergraduate degree, and it can be in any concentration. People normally take the traditional route, which is biology or the chemistries, but you can also major in something else that you prefer, and you can take all of the science classes. So that brings me to my next point, which is the science prereqs. Drew requires the biological sciences, anatomy and physio, gen chem, statistics, English, behavioral sciences, but it's contingent upon the school. Whichever school you're applying to might have more prerequisites that they require. Next is the GPA requirements. So here at Drew, we have a 3.0 is required overall, and a 3.0 is also required for your science classes. We did not have to take the GRE to get into the school, but some schools do require that you do take the GRE. And if you do decide to take the GRE, there's a lot of resources out there that can help you excel. Number 4 is clinical experience and shadowing. So you need patient care, and you can do that by becoming an EMT, EMS. There's some people that are medical assistants. I had the opportunity to become a medical scribe, so I use that as my patient care. And also you want to shadow. So shadowing a PA will give you great exposure as to what the field is about. So you would have to recruit someone or find someone that you know and shadow them for a couple days, get to know what it is that they do on a day-by-day basis. And number 5 is community commitment. Here at Drew, we hone in on being involved in the community, and we actually have something called the Social Justice Society. So that gives us the opportunity to be involved in the community. And being involved in the community means volunteering. You can volunteer at your local church, you can volunteer at the YMCA, you can volunteer at a food bank, but they want to see that you're involved. Something that my class have recently done is we did a trash pickup within the community of Watts. So that's how we become involved and make sure people know us, know what we do, and it gives exposure to our profession as well. And I'm going to pass on to Nicole.
Thanks, Daphne. Okay, so now another golden question. I mean, we all want to know what we're getting ourselves into, and a big thing with that when we're looking towards the longevity of our career and life is how much money are we actually going to make? So in 2019, the median salary, so the middle salary, was about just over $112,000. And another thing to take into consideration too with this is that the unemployment rate was less than 1%. This does not include everything that happened in COVID, but prior to that, that's a really good number that we want to pay attention to, because that means that there's a lot of job opportunities. But beyond those numbers, we also want to think about the like how the job makes us feel, how successful we can feel in it, the work-life balance, all of those things. And based on that, there's quite a few surveys that are put out there for people that for PAs to rate how it goes for them. And the past couple of years, the past 2 years, if not more than that, the PA profession has been #1 in the top 100 best jobs. And prior to that, it's always been at the top, just maybe not #1. And it's also #1 in best STEM jobs and best in healthcare jobs overall as well. But when you're talking about work-life balance, there's things that you want to consider. You're going to work a typical 9-to-5 job. What is the job security like? Or looking at things like, where do you want to live? What type of setting do you want to be in and practice in? Do you have time to enjoy the things in life outside of work? So the PA profession is showing up to be a really good option for these things. And so that kind of sums up the PA profession in a nutshell. And now we really want to take the most of our time with you to have questions and discussion. So I'm going to stop sharing my screen and just open up the floor if we want to take some general questions here, and then we can see if we want to move into breakout rooms.
Well, actually, we're going to ask Reggie. I think we have questions, and I think you guys did a great job of answering most of them. But I want to see if there's anything that was remaining. And then I think the idea of breaking out in breakout rooms might be nice if, students want to hear from, particular people and their experiences. We can do that. Yeah. So Reggie?
Yeah, so we do have a few questions prepared for you. Feel free it doesn't matter who answers the question, it's open to all of you guys. But my first one, just a general question, what made you guys in the first place want to become physician assistants or PAs?
I can start talking and any other the CDU students can jump in. So one of the main reasons why we wanted to connect with you guys is that we did not learn about the PA profession soon enough. And had we, a lot of our paths to it may have changed. So I think that for me, I went through my undergrad, I did a master's degree, I worked for 10 years in research, really loved it. And then I started to not see people as much. I was working behind a computer and working with numbers, working with a very diverse team of medical providers. And I saw the PA role and I loved how they integrated themselves. It's like a true team player. They work with the nurses really well. They work with the physicians really well. They have extra time with the patients that the physicians don't always have. And so I started asking them questions about what it was like and, their backgrounds and, the time they spend at work and all the things that end up important to you when you are considering different career choices. Anybody else have anything to share with that?
Yeah, I'll add on to that, Nicole. So I think one of the things for me that drew me to the PA profession as opposed to, going for, being a doctor or something is a little bit, Nicole alluded to this, is, the doctors a lot of times have to do a lot of like behind the scenes, like paperwork, talking to your insurance and stuff like that. And being a PA theoretically kind of gives you a little bit more interaction with the patient. So I think being more of, patient-centered, having a little bit more flexibility in the lifestyle and different things like that kind of, is really appealing to me. And then I know this doesn't apply to anybody here, but I was getting a little bit older too, and the 2 to 2.5 years to get into the workforce was also another driving point for me. So that's another thing to consider.
I'll jump in on that question too. So I had always kind of wanted to do medicine since I was little, but then kind of lost my way in college and couldn't decide what I wanted to do, and did a little bit of a career after college that was somewhat related to medicine, but not quite what was filling my cup up. So I wasn't sure I wanted to go become a doctor and spend the time and effort and energy that it takes, because it's a big commitment. And wasn't positive what I wanted to do. So I didn't have to choose, and that's what I had to do the rest of my life. The laterality aspect. In a bunch of different specialties, we can change if we don't like something. We can be in the emergency department. We can work in dermatology. We could do pulmonology. So I just really like that we have the freedom to kind of change our careers and move around, work with different types of providers, and yet we still get to be the ones making medical decisions.
Thank you so
Can I
much.
add on?
Oh, go ahead. Sorry.
I'll make it really short. So for me personally, like my entire life, I wanted to be a doctor. I had made that decision up until my third year in college, and I ended up going through a lot of mental health issues. And so I decided to scrap it because there are a lot of factors into become a physician. It's like the amount of time you have to put into it, the amount of debt that you're going to go into. I was going through a lot of stereotype threat as well. Like, will I be able to like get through all of those years? Because I was still studying, I was still kind of struggling undergrad. So I didn't know like if I'm struggling undergrad, how am I going to make it through medical school? How am I going to study for the MCAT? How am I going to pay for the MCAT? So all of those things were going on for me. And so I decided to see if I could find another field where I could interact with patients, still do the medicine aspect of it, but without all the other factors that were kind of deterring me from it. And I had a fellow student that was like, oh, what about the PA profession? And she kind of talked to me about it. I did my own research. And I like the fact that I wouldn't have to do one specialty for the rest of my life. Because when you go to medical school and you try to match for a specific field, you can choose orthopedics, but if they don't put you in that field, they might put you in primary care, and then you're stuck with primary care for the rest of your life. And I didn't want that. So I really like the fact that, you know, if I want to do family medicine for 2 years and then quit and do dermatology another 2 years, I can do that. And I wanted the work-life balance. I wanted all of those things and being able to make a 6-figure amount every year. So to me, it just seemed like a gift given to me in a time that I really needed some clarity. So that's why I decided to go ahead with the PA profession. And it wasn't easy. Like Daphne went through all the steps, but I was able to do it. I had the support from my family and friends, and I have the support of my classmates now. And so that's what's kept me going through school, even though it's difficult. And I do think it's a big reward at the end. So I'm excited to graduate. So that's kind of my story and why I wanted to become a PA.
Thank you so much for that. So I do have one more question before we go out into our breakout rooms. What was your career like before COVID-19, and how has it changed like due to the impact of the virus?
I'll start talking again, and anybody else can jump in also. So being students, I'm sure that you guys experienced a lot of the same things that we did. You know, it's, you go to school on, I think, Tuesday or Wednesday, and we're like in the midst of midterms, and then all of a sudden they're like, actually, you guys get to go home, and we're not sure what's going to happen tomorrow. And then we didn't skip a beat. The next morning, we were all online. We finished up our midterms, and then life has just been virtual since then. And then in October, we moved into our clinicals. So right around the peak of COVID, we actually entered the workforce as student volunteers, essentially. And we were in places from like the ED, the emergency department at Cal in like downtown LA, to surgery centers, to women's health clinics. So we got to see a wide variety of things during COVID. I don't know, I can't say that it's really affected our education. I think that it's been very different being educated in a pandemic, as you guys are all experiencing. We're learning a lot of different things. Hopefully it will help us out in our career and our life, and hopefully we don't have to experience this again, but we're getting through it. And if anybody else wants to talk about it, maybe somebody from the first years, David or Daphne.
Sure, I'll jump in for the first year. So we when we started, everything was already transitioned online. Nicole's class had to kind of take the brunt of that, I think, for sure, and be the trailblazers for us. So we did have to go in a few times for like skills, and I'd say like once or twice a week, just because there's some stuff you have to be able to do in person. But just I guess to talk about the process, we were regularly getting tested before we got on, given all the PPE and everything. So it was definitely a transition, I think, more so for the class before us, but we still had to go in once or twice a week. I think, I don't know, I think almost in a way, like it's a little bit, in some ways there's benefits to having online. All of our classes are recorded. That kind of helps to be able to rewatch them and stuff. And it's a little bit easier to roll out of bed and hop into your computer. I think the thing that you have to be wary of is, you're cognizant of, is like the mental toll of not being in person and not seeing people and being only on these Zooms and everything. So I think that kind of gets to you, and hopefully we kind of take some of the skills we've learned from having to do that, and we can have that, bring that with us into like our own lives in our day-to-day interactions, and kind of have a little bit more of a little bit more of a mental health aspect that we can hopefully carry with us as we go into the workforce. But I think those are pretty much the ways that it's affected our class. I don't know if Daphne, you have anything you want to add to that?
I had something I wanted to add to what Nicole was saying as a second year. My name's Katerina Yu, by the way. I'm a second year along with Nicole. I think speaking on the, the whole new, nuance of like Zoom and like being able to like take classes on Zoom, I think that also kind of transfers to a new age of healthcare as well. I'm sure maybe some of you all or your parents have gone to telehealth visits with your doctor instead of going into the clinic because of, safety issues. And I think that that has also been a new challenge, but also really exciting because we are able to reach more patients and be able to talk to people more readily by being able to do FaceTime or phone calls. And so that has been an interesting experience as a student as well, and something definitely I think will continue to grow as you all join the healthcare industry, hopefully.
Yeah, I have something to add. Can you guys hear me? Okay, so I chose neurology as my elective, and I got to go into the office, but a lot of my patients that I saw were over the phone, which was really hard for me because I've been passionate about neurology for years. And so when I got there, I was like, where are the patients? So I had to I don't really like talking on the phone. So it was kind of hard for me to connect to them at first. But I think after a while, you kind of realize, like Katarina was saying, this is kind of like part of healthcare now. And especially now that COVID has started, I'm sure that, you start thinking, okay, maybe one day out of the week, I can stay home and see my patients that are not so acute, or, it's just like a different way of living or working in a sense. So it's kind of like good and bad in a way.
Good points, everybody. Thanks for sharing.
Yeah, so it kind of seems like there's pros and cons to it. So thank you guys so much. That's all the questions that I have. I'm gonna pass it to Ms. Thigpen so if we can put you guys in breakout rooms and the students can ask some questions and we can move on from there.
Okay, so I've created manual breakout rooms. You guys can pick where you're going, but before I do that, I would like to place the PAs in the rooms. So we'll have the main room. Reggie will stay here with Nicole. Would you like to stay in the main room? Okay. And then can you, April Sandoval, Beverly, and David, I'll put you in one room. Does that work? Oh, there's lots of you. Wait. 1, 2, 3. Okay, we'll see. So let me assign you there. And then So let me rethink this. Maybe it's better if I just make the computer decide, because I'm afraid my quiet students aren't going to go anywhere. So let me try it again. So I'll make sure we have some people that stay here. Oh no. Okay. Let's try it. So students, I'm going to keep it manual actually, because I have it created for you guys. I'm going to open all the rooms in just a minute. I just want to make sure, where did I put? Yes, I want to keep you here. There we go. All right, so I'm going to open the rooms, and in the main room will be Nicole, John D, Daphne, Timothy, and Katerina. Okay, and then Diamond, I want you to pick one of the other rooms. Miss Soto, if you could pick one of the other rooms. And I'm going to just start moving students. I'll try to keep about 20 students in here with us. And I'm not sure, Shelley Reed, is that a student or a Kindred student or a PA?
She's a Kindred student.
Okay, she didn't rename herself. Okay. Diamond, yeah, you can pick whoever you like, my love. Miss Soto, which room do you want to go to? I'm muted.
Minnesota.
Oh, Miss Soto's muted. Okay, I was like, okay, I think I have it pretty even, but let's see. Okay. Yep, this will be our group. So now everyone has to get unmuted and talk.
Perfect. Thank you so much. All right. Any King Drew students want to start us off with another question? Was this interesting? Had you guys heard of the PA profession before? How many had heard of the PA profession before? You just want to put your hand by your face. Okay, so good. I'm glad that we introduced it to you guys, because as we mentioned, it was something that we hadn't really heard of. Yeah, and even if you have come into contact with a PA in the hospital or as your family doctor or something like that, you might not know the details behind it. Jandy or Time or Daphne, Kat, anybody have any questions or comments you want to throw out there?
I would love if maybe you guys could also maybe tell us a little bit about your undergrad experience, because a lot of these students are obviously college bound, and to hear your experiences, I think I would love to hear from a Katerina or from any of the other John D, whomever else would like to share about that.
Absolutely, I can start. Oh, Jandy, do you want to go?
Oh, no, you can go first.
Okay, all right. So my undergrad, I went to UC Riverside out in the Inland Empire. I don't know if you all have ever heard of that, but that's my alma mater. I think like many students coming from high school, going into college, most of us know that, like, we want to go to college and we're thinking about it, but we don't really know what we're doing. I think at the age of 17, which was when I started college, I didn't know what I wanted to do. And to be honest, I just wanted to move away from home. I'm from the Bay Area and I just wanted to stay in California but move away from home. And like many of my classmates, I had an interest, in my high school classes like biology, chemistry, and I really loved anatomy in high school. But, I went into college like many pre-PA and pre-med students do as like a biochemistry major or a bio major, a health sciences, something of that sort. And you go through your typical classes your first 2 years, including things like biology, chemistry, the dreaded organic chemistry, physics, all that tough stuff that you hear about on like TV shows. And then you also get to take a lot of electives. And that's kind of where I realized that I have a passion, much like Shelby had mentioned, for neuroscience. And so I actually switched my major to neuroscience and I started really loving learning about the brain, all the cool things that it does to control the body systems and how diseases can affect the brain, particularly things like my grandfather had Alzheimer's. So that was something that was really interesting to me. And, like even after graduating college, I still for 2 years really was unsure whether or not I wanted to be a PA. I was really stuck in between, being a doctor, a PA, or actually even a pharmacist. And it wasn't until after I got some work experiences as like an EMT, as some people mentioned, and as like a farm tech and a scribe, that I really realized that I think PA was a path for me. It allowed me to be, the closest to patients. Being able to be a patient advocate for the underserved was a really big thing. And I think that sometimes doctors, like, they get so overwhelmed with administrative duties and things, they lose sight of the reason why they go through all that education. It's for the community, it's for the patients. And I think that that's something that I definitely learned throughout undergrad, volunteering a lot, serving homeless populations, serving the Black and Latino community. And I think that if anything, everyone's unsure about how college is, meet your core group, go out and volunteer, do things that you're passionate about, whether that's teaching kids youth sports, whether that's feeding soup kitchens, whether that's tutoring. Those kind of things honestly like really kind of shape who you want to be in your career. And I think that obviously, we're all kind of confused about where we want to be right now, but do the things that you like and your career will speak out to you is what I have to say.
Hello, everyone. I'm Jandy. So I'm originally from Florida, so I went to school in Florida. Daphne, that's my Florida girl right there. So just advice, like undergrad for me, it was hard because like, you want to hang out with your friends, you want to meet new people, you want to try new things, but at the same time, you want to keep in mind, like, you're there and you're paying money. So if you think you're not gonna, pay now and just enjoy yourself, like it's gonna come back around. So my main thing is, like I want you guys should have fun, enjoy college and, try new things, volunteer. Like Katarina says, like I volunteered a lot in undergrad and you make connections and you meet new people. But at the same time, try not to like get overwhelmed with classes. I know one thing for me, I used to take so many courses. Like I would take 17, 19 credit hours, and then I would also work full time. So I would only sleep on like the weekends. So my advice to you is like, don't overwhelm yourself, take it easy, do as much as you can. So that way you can do well in your classes and also learn, do well in your classes and then also make time for extracurricular activities. So that's like one thing I would say is just, try to find a good balance of like working and school and socializing in order to be successful.
Thanks, Kat and Jandy, for sharing. King Drew students, please unmute at any point if you have a question. Otherwise, we'll just kind of keep going with things that we've thought of to share with you. Tim A. or Jandy or Daphne or Kat, does somebody want to share about, thinking back on high school and any advice that you have for people that are finishing it up and looking forward to college?
Yeah, hi, can you guys hear me? Yeah.
You just
I think
muted
you
yourself.
unmuted.
Okay, is that better? Okay. All right, so I'm really excited to be here with you guys. When I was in high school, I'm the first person in my entire family to go to high school. I was always taught not to go to high school, that it was a waste, or sorry, not to go to college, that it was a waste of time. You know, you have bills to pay, you got to work for your family, you got to support your family, and that's the way I was raised. So it took me a while to realize that, you know, working, it's great and all, but you have to think about your future too. You got to think about your life when you get older. Right now, it may not make a lot of sense to make a lot of decisions. You guys are going to start graduating high school, and some of the decisions you have to make aren't um, don't make sense at this time, and that's okay, and that's normal. But I just want to encourage you, whether it's the PA program or not, I want you to encourage you to even think about college, to know that that's an option, and to try to attain that, because um, you know, when I was growing up, a lot of people that I hung out with weren't going to college. They weren't doing the right things. And just because you're from a certain area or a certain place, doesn't mean that you have to do what everybody else is doing. Because um, you know, from a certain neighborhood doesn't mean that you got to do those things. Doesn't mean that you have to act a certain way, talk a certain way. I want you to know that just do what you want to do. Really believe in yourself that you guys can attain these great things. Go to college, get a great career, because it's all available to all of us. It's not just for smart people. It's not just for rich people. It's not just for blacks, whites, Hispanics. Everybody can attain this. So I want you guys to know that, and to really believe that, and know that you guys can do this. You guys have a lot of time ahead of yourselves. You guys are just starting out. One of my first jobs was as an EMT. I didn't like working indoors. I hated working at a desk. So I like to be outside. I liked, having a new day every day. And one of the options I took, if you guys are any of you guys trying to go into medicine, definitely consider becoming an EMT. It will give you skills that other jobs won't give you. You're working on an ambulance, first of all, responding to emergencies, and you grow really quick, but in a good way. You become more mature. You don't have someone like a boss looking over you saying, hey, you got to do this, or telling you what to do all the time. You have a lot of independence. And if you do plan on becoming or going to the medical field, it's one of the great ways to find or to get patient care hours. Everybody's going to need patient care hours, and learning stuff on an ambulance isn't stuff you're going to be taught in a book. A lot of the things come at you really fast, and it's something that a book can't really teach you, and it's going to help you when you do decide to go into a field of medicine. And so I really encourage you guys to look into that. I know Compton College offers a EMT course. Should be a semester long, 6 months. There's no prerequisites. So that's something you guys can look into starting out now. It takes a while for you to get this experience, and now is a great time to start looking into jobs or things that will get you that experience, because it's a requirement. So yeah, I'm gonna stop talking now, but definitely consider your options, and please consider college as an option.
Thank you for sharing your personal story, Tim. Emily, I see
also,
that your hand. Oh, sorry, Reggie. I see Emily's hand up.
Oh, Emily can go ahead. I just wanted to add something to his point really quick. I know you guys are juniors. If you do end up taking Miss Harris' class next year, you can actually, like he was talking about, get your EMT certification. I'm right now taking classes to get my pharmaceutical certification so I can be a pharmacy tech. So things like that really do help for your one, getting into college, and then a journey into medicine. I'm pretty sure me putting that on my applications got me some acceptances. So I do actually recommend that. So thank you, Tim, for that advice. But Emily, I did see your hand up. You have something you want to say?
Yeah, so I'm also a senior ambassador like Reggie, which means like I'm gonna graduate soon. And I know a lot of you guys work jobs while you were in school. And my biggest worry at the moment is tuition. Especially I'm the second one to go to college in my family. So I have my sister there helping me out. She's going into her master's soon. So like I have her, and she's like a really great resource, especially because she's family. I can talk to her like about everything, but I don't want to worry myself with too much, like, and overwhelm myself with classes and a job. So do you guys recommend working a job while, you know, getting a degree, or how do you guys pay like your tuition, or were you guys worried? Just like more information about that or personal experiences.
I don't mind going. So I actually worked throughout undergrad. I've always worked. There are some hiccups when you're working and you're taking classes. Like it does have some challenges, but I'm not going to say that it's impossible. If you can try doing something part-time if you have the financial resources, or if you have your mom and dad that you can consult with, just in case you need like spending money. It's not impossible, but it's doable. And there are some issues that comes with it. Like your job must understand that school comes first. So make sure you try to relay that, my number one priority is school. This job is secondary to school. And once they understand that, they'll probably be a little bit more lax, I should say. I think in undergrad, I'm trying to think of where I worked. I worked so many places, but I think most of the times it was like retail, something part-time where I only had to do like 15 to 20 hours a week. So it didn't interfere with my school schedule. I think the number one thing that you have to implement is discipline. Once you know how to discipline yourself, then you'll know how to allocate your time between school and work.
Oh, also, I would like to add, there's a lot of scholarships out there. Like, there's a lot of free money. It's just, do you want to put in the effort? I know my little sister and her friends, because she's in college right now, she and her friends, they like applied for every scholarship, even if it was like $500. They applied for it, and then once it was time to distribute those scholarships, they had like stacks and stacks of scholarships that you can kind of use. So there's a website called Showly, and I'll put it into the chat, where you can kind of go, and it kind of shows you like different scholarships that you can apply to. Some of them do require essays, some of them just require your first last name in high school. So just, try and talk to your guidance counselor, see what scholarships are available out there for you. And like what Daphne says, working helps because it teaches you responsibility. It teaches you how to manage your money. But like Daphne also says, like, remember that school is your priority, and you have to kind of voice that to your employer when you're, hired.
Definitely, I want to add to that that's definitely a concern to work and to go to school. I know as an EMT you have downtime, so I did a lot of my studying while at work. Not to rely on that because some days they are busy, but I was fortunate enough to have a job where I can work, and study while I was working because you're not always busy. But definitely keep in mind that GPA is should be your number one priority because that follows you, and that is what like hinders a lot of people from getting into different schools. So definitely, like your GPA really is very, very important. Do not take that lightly.
Thank you, everybody. So I think that you guys have your next class coming up. So we're going to have to start wrapping up here, say our goodbyes. But please let everybody know, I can, Ms. Thigpen has my email address. And, if you have somebody else specific here that you remember their name and want to talk to, let us know. And we're happy to, keep fielding questions and keep talking to you guys. So I appreciate your time.
We thank you. Thank you all for being here. Everyone's coming back, hopefully. So I know you guys have class, but we thank you. And I went to the other breakout rooms. They were having actually very lively discussions as well. So this has been very important. We hope to have you again, maybe sometime again this year. So we'll talk more about that. And thank you, CDU students. You're awesome for being here and inspiring our kids.
Well, thank you all. And yes, we will talk soon.
Yeah, thank you so much for joining us. I learned a lot of valuable information.
Thanks for being the host, Reggie. You were great.
Thank you.
Take care and finish your year off strong.
Thank you.
All right, we'll just wait for everyone to come back. If you need to log off, it's okay. We thank you. Just trying to just wait for everyone to come back to say their thank yous. I think everyone is back now. Ms. Cooper and Ms. Soto are here. Yeah, okay, cool. All right, so they have class and you guys are almost done as well. So I will be speaking with Nicole. We would love to have the panel again and talk more again. So we thank you, and you can stop recording now, Reggie.